Hi, this is Amitabh Pandit here, and I've been receiving many responses for my videos. So, in response to one of the requested topics, I'm going to be talking about PCOS or PCOD, polycystic ovarian syndrome or disorder. It seems like many of the people who have watched my videos, they are concerned that either they or someone they know have a disorder by the name of PCOD. So I'll get straight to it and start as to what exactly is PCOD. Polycystic ovarian syndrome is actually a congestion of the ovaries, and this happens because of a hormonal imbalance in the body. I will take an example of two cases that I have seen. One is the case of a young girl who, at the age of 12, she started menstruating, and by the age of 15, her menstruation cycle had stopped, and she had developed severe acne on the face and parts of her body, and she was showing symptoms of excessive hair growth, weight gain, and some elevated blood pressure issues. She went to a gynecologist, and her gynae suggested that she should be put on a specific medication by the name of metformin and OCPs, that is oral contraceptive pills. Similarly, I had another case in which this lady who was 33, she wanted to conceive but she was unable to, and she had symptoms of acne and excessive hair growth, especially on the face, and she was gaining weight, and very stubborn weight, unable to lose the weight, and this was in spite of working out and gymming and dieting. The weight would not budge. She went to the gynecologist. The gynecologist gave her the same medication as metformin and one of the oral contraceptive pills, and the gynae asked her to lose weight. However, the thing is that there's a vicious cycle. Because of the hormonal imbalance, it is very difficult to lose the weight, and your gynae will most likely suggest that once you lose the weight, your ovaries will start ovulating much better. But that is not the case, and it never happens, because the weight of an PCOD person is extremely stubborn. Now, what exactly is PCOD? As I said, it is a congestion of the ovaries. What happens is that every 30 days there is a cycle in the woman's body, and one ovum is released. When this ovum does not convert into a menstrual cycle, then another ovum is released the next month, and as time goes on, they start getting clumped together and they form a cyst. Now, the symptoms of PCOD are mostly either there is no period, there is no ovulation, there is weight gain and obesity, excessive hair growth, which is also known as hirsutism. There is insulin resistance, and mostly the PCOD person is also given a drug, as I said, metformin, for preventing diabetes. There is acne, there is an ultrasound of the lower pelvic region shows that there are multiple cysts. There is also a darkening at the nape of the neck and maybe the underarms, which starts happening in the body. Now, mostly PCOD problem, the conventional treatment is that the oral contraceptive pills are given. However, I must say that this is the worst kind of or misplaced treatment and ill-advised to a patient, because the OCP just takes care of the symptom. It does not take care of the root cause of the cysts being formed, and it does not regularize the hormonal balance. It just is able to control the menstruation, and this also has side effects. If you start at an early age of 15, if you start taking oral contraceptive pills and you have to keep taking them just to regularize your menstrual cycle, over a period of time you are invariably going to show some severe symptoms and deficiencies. In fact, the oral contraceptive pills also lead to a deficiency of vitamin B12, which will affect your neurological symptoms, your system and the brain. So, what would be a good treatment? Well, first of all, I would say that if you go to the real cause of the ovarian cyst, that is clumping or congestion in the ovaries. Now, this has been researched and found that if you correct your diet, if you correct the internal body chemistry of the body of your system, then the hormonal system starts coming into balance. So what ingredient, what element is mostly required? The primary one is iodine. It is the deficiency of iodine in the body that will lead to swelling of the ovaries. It will lead to cyst formation. And it has been found that the greater the deficiency of iodine in the body, the larger number of cysts in the ovaries. And this has been found out by an extensive research in Russia. And there is a well-known doctor on the internet. You can Google him and also see his videos, by the name of Dr. Braustein, who has been recommending and treating patients of PCOD with iodine. Similarly, I have been seeing many people and young girls, as well as through my videos and through my emails and through my website, which is www.authorpandit.in and amitabhpandit.info, that I have been treating as well as guiding people as to how they can overcome this disorder without any medication, without any side effects, without any after effects, and get to the root of the problem and correct it so that they do not have any more cysts in their system and their menstrual cycle is regularized. So let me show you some of the things as to from where you can get the iodine in the best forms. And please do not believe that because your salt, the salt that you use at home, which is on your table, the iodized salt, it has so much iodine that it will correct your iodine deficiency, or it will correct your PCOD. No, it will not, because you do not take into consideration that the iodine in that salt gets evaporated. It is no more present by the time you start eating it, and it is so minuscule in quantity that it can hardly have any effect on the human body. However, it does prevent goiter, and that's why the law is there that the salt must be iodized. So without any ado, I'm going to show you some certain foods which you can get. One is the Himalayan crystal salt. This, as I'm showing it to you right here, it is Himalayan pink salt. It is the Himalayan crystal salt, and this salt has such a large quantity of iodine in it naturally, not added, that it will benefit your system and give it the iodine that it requires. Besides this, there are a number of sea vegetables that you can eat, and I'm going to show you some of them. One of them is this hand harvested sea vegetable, which you can get in the market. If you're living abroad, then it's very much easily available. If you're living in India, then it is available online, and you can source it via any website. Then this is another vegetable very rich in iodine, wakame. Wakame, and this one, another vegetable that I'm showing you, dulse. These are extremely nutritious, extremely tasty, and it will give you natural iodine, which is present in the sea water and in the sea. You see, the sea is extremely rich in minerals, and these vegetables, they absorb the iodine, and when you eat them, then they are assimilated and they have no side effects, no after effects. It's absolutely natural, 100% natural, and your cysts will start dissolving. There's another form of kelp. I've just shown you wakame and another sea vegetable. There's another sea vegetable by the name of kelp. This is available in this kind of a format. It has, as you can see, an excellent source of iodine. It is written on it, and this is kelp, which you can pour or just sprinkle on your food or your salad, and you can eat it. And besides this, some regular foods also contain iodine. That is your plain yogurt, strawberries, cranberries, and your boiled eggs. These are all rich in iodine, and you must have extremely large quantities of iodine initially, so that the cysts start dissolving, and over a period of a few months only, you will see that your menstrual cycle has started regularizing, and over a period of time, you can get your ultrasound done, and you will find that the these are no more there, and your hair growth has stopped, especially on the face, the facial hair growth that comes on PCOD patients, and your weight starts dissolving, and it'll become much easier for you to start losing weight. Now another thing that I would like to show you, and this is the mother load, that if you're unable to get any of these vegetables, absolutely unable to source anything else, then this is the mother load that you can get. This is a supplement by the name of Lugol's solution. It is available in two variants, 2% iodine and 5% iodine. I would recommend 2% because I've had great fantastic success with it. Whenever I have given this to any patient or any person who has asked me for his guidance for PCOD, they have shown remarkable results. This form of iodine has the capacity to dissolve cysts anywhere in the body, whether it is in the breast, whether it is there in the ovaries. It will dissolve cysts anywhere in the system. This solution needs to be taken 5 to 10 drops daily, and one can increase it also. If there are a number of cysts, then one can take it twice a day or thrice a day. So it just depends that if you're unable to source any other food and you're just dependent on this, then the quantity will be much more. If you're eating the rest of the foods and taking this supplement, then the results will be faster, and you will see the miraculous results that you can have and not depend on any medication. No side effects, no after effects. Regular menstrual cycle will come back, and you will have no more facial hair growth. You will the nape of the neck darkening and this darkening of the underarms will absolutely vanish, and the weight loss will become so easy. It will be so smooth. Thank you for watching. Please subscribe, and if you have any personal questions, then you can get in touch with me via my website or my Facebook page, my blogs. I love to hear from you, and thank you for watching. God bless you.